This short video will review the prior authorization process for Blue Cross Blue Shield Federal Employee Program members. As announced on January 1, 2024, Blue Cross Blue Shield Federal Employee Program, FEP, requires prior authorization for members who wish to purchase hearing aids using their FEP hearing aid benefit. Although FEP has made this a requirement, True Hearing will handle all processes needed to obtain the authorization. True Hearing has made this submission process easy for both providers and members. Following these steps enhances the likelihood of obtaining authorization approval and minimizes unnecessary delays in the ordering process. Step 1. Obtain the audiogram and documentation of medical necessity. This step looks different depending on whether the member is a first-time hearing aid user or an existing hearing aid user. Since the implementation on January 1st, we have come across valuable directives proven to increase the prior authorization approval rate. Use True Hearing's checklist in Echo to gather all necessary information prior to submission. Once you have logged into Echo, visit the Form section and find our Blue Cross Blue Shield FEP Prior Authorization checklist. If submitting prior authorization for a first-time user, medical necessity should include the following: a comprehensive audiogram completed within 6 months prior to the hearing aid purchase, written documentation of the level of hearing loss and the type of hearing loss. Input this information directly on the checklist. It is important to note that FEP considers a hearing loss of 26 decibels or greater for a hearing aid to be medically necessary. Hearing aid recommendation that is approved, listed, or registered with the FDA as a prescription device. Write in the name of the recommended devices. If submitting prior authorization for an existing hearing aid user, medical necessity should include the following: patient's hearing aid history, patient's pertinent medical history, including a description of functional status and relevant prior treatment, comprehensive audiogram completed within 6 months prior to the hearing aid purchase that includes the date of testing, type of testing, and level of hearing loss. Results that clearly show the need for hearing aid replacement. This must be clear documentation the device is no longer functioning adequately and has been determined to be non-repairable and is not under warranty, or a significant change in the person's hearing that requires a different hearing aid. Recommendation for type of replacement device. Plan for follow-up care including the trial period and warranty information. Step 2. Upload the audiogram and documentation of medical necessity into Echo. After you have obtained the audiogram and completed the checklist, you can then begin the prior authorization process in Echo. After you have completed the checklist in its entirety and gathered all appropriate documentation, upload these documents in the Customer Notes tab of Echo. At minimum, you will upload the current audiogram and completed checklist. Additional documentation may include previous audiograms, medical report, etc. Complete the visit in Echo, place the order for the recommended hearing aids, and collect 50% of the payment at the time of order. True Hearing will then submit the prior authorization request on the patient's behalf. The prior authorization process will take approximately 15 business days. Once we receive the approved prior authorization, we will promptly order the hearing aids from the manufacturer and they will be delivered to your clinic. Providers will not receive a notice of approval. However, they can check the Customer Notes section in Echo for important updates. If any documents for prior authorization submission are missing, a member of our designated provider support team will promptly contact the provider to obtain the necessary items. You will be able to monitor patient notes in Echo as we move forward with the ordering process. In the event an authorization is denied, our dedicated provider support team will promptly reach out to the provider to notify them of the reason for the denial. Blue Cross Blue Shield Federal Employee Program will send out a letter to the member letting them know their prior authorization was denied. Common causes of denial include insufficient loss. The patient's hearing loss does not meet the degree of loss criteria as defined by FEP, or the patient is ineligible for benefit renewal, meaning their current hearing aids are less than 5 years old. If you have any questions about submitting prior authorization requests for Blue Cross Blue Shield FEP patients, please contact our provider support team. Agents are available Monday through Friday from 8 a.m. to 8 p.m. Eastern Standard Time, and through the chat function in Echo.